The first signs that I had that something was wrong was that I had pain in my upper back, and it just kept getting progressively worse, but it never went to my chest. And then I collapsed on the floor one morning in my apartment, and my hero dog over here, he started to howl that morning and relentlessly. And I reached out to Dr. Reynolds. I didn't think I had a heart problem, but I trusted she would get back to me, whatever the problem was.
I saw this message saying that she was having back pain and shortness of breath, and I think she was expecting an email message back. But I called her right away because I was concerned that might be heart attack. Back pain and shortness of breath may not be chest pain that other people might recognize as a heart attack symptom, but we know those can be heart attack symptoms. So I called her and I heard that she thought, if I can take this pain, it mustn't be a heart attack. If it were a heart attack, there's no way I'd be able to handle it. And I've heard that misconception before. People think that a heart attack must be the most severe pain they've ever had, and it doesn't always work that way. People think a heart attack has to have pain in the front of the chest or on the left side, but it doesn't always happen that way.
Dr. Reynolds knows me, and she looked at me. It was the first time she said, "You've had a heart attack." But she said to me also, she said, "I can fix this."
The area that was affected was relatively small, and it was clear that there was an opportunity to salvage a lot more heart muscle if we had her have an angiogram and hopefully get a stent.
After hearing about her story, I agreed that Charley should have an urgent catheterization, and we did the catheterization, which showed that the artery to the front of her heart, her LAD, was near totally occluded. So after the angiogram, we were able to place a wire down the LAD and put one stent in and restore normal flow to the anterior wall of the left ventricle.
Even though there's a pandemic, people are still getting sick. In my case, people are still having heart attacks, and ignoring symptoms, they're not going to go away, and they're not going to wait to be treated until after the pandemic. So I said to people who've called me, don't wait. I usually say, if you're in the Langone network, your hospital, go, because I can speak to the treatment there. It was exceptional.